Hey, it's Mo Egger. Summertime means warm nights on the outdoor patio at Long Neck Sports Grill. They've got 4K TVs outside, so you don't have to miss a game. Awesome wings, Northern Kentucky's best beer selection, great service, 3 terrific locations in Northern Kentucky, and maybe you could have a Long Necks in your neighborhood. Your chance is here. Go to longnecksportsgrillfranchise.com. That's longnecksportsgrillfranchise.com. Long Neck Sports Grill. Stay long. Come often. On Wednesdays, we chat with one of the experts. We talk injuries with one of the experts from OrthoCincy. The great thing about OrthoCincy is they've got specialists and locations throughout the tri-state, and they also walk in orthopedic urgent care during the week from 9 a.m. to 9 p.m. and on Saturdays from 9 a.m. to 1 p.m. in Edgewood and Anderson. Learn more at orthocincy.com. orthocincy.com. You never need an appointment. Joining us this week is Dr. Trevor Wilkes. So we got some bad news yesterday about both Cristian Encarnacion-Strand and Brandon Williamson. Let me start with Brandon, who he leaves a start during spring training. They put him on the 60-day injured list. He makes 4 minor league starts in a rehab assignment that began back in mid-May. They shut him down for a few days. He had been pitching well, looked like he was getting closer to making a comeback. And now he is exploring the possibility of surgery because he is dealing with a Bennett lesion. I've never heard of this. Let's begin with that. What is a Bennett lesion?
Yeah, thanks, Bo. That's actually a good one. This is kind of in my wheelhouse as a shoulder guy. But a Bennett lesion specifically refers to calcifications, so calcium or bone that's in a place it's not supposed to be in the back of your shoulder. It is associated with tears of the labrum. So the labrum's a rim of cartilage that helps hold the ball in the socket. And what happens, Mo, is these pitchers that have just thrown thousands and thousands of reps, they begin to constantly irritate the back of the labrum and the back of their shoulder socket, and that creates inflammation. And in certain patients, that inflammation manifests as these little calcium deposits in the back of the shoulder. And it's super interesting because if you just go grab 100 high-level pitchers and x-ray them, you can sometimes find 1 or 2 who have that and don't even know it. But in other people, it causes constant inflammation and can be an impediment to them and their pitching career.
Is this related to the strain that originally put him on the injured list?
Yeah, I mean, it's obviously hard to know for sure, but you'd have to think that it does have something to do with it. And, you know, it is likely related to why he was off since the preseason and why he had the trouble when he tried to make those starts coming back. So I would guess yes.
All right, so now they're trying to determine whether or not he's going to need surgery. Is this particular issue, does it usually require surgery? And if it does, what's the long-term and I guess also short-term prognosis?
Yeah, so good question. But so typically we will try conservative treatment first. Shutting them down, anti-inflammatories, throwing rehab. But I would consider that this period of time that he's likely had, they're going to consider that a failure of that conservative treatment. So in those situations, yes, it becomes a surgical issue. It's an arthroscopic surgery or a minimally invasive surgery in which we remove the calcifications, repair the labrum, and then rehab, and it is typically a 6 to 9 month rehab.
All right, so it's June. Let's say this were to happen here in the next couple of weeks. 6 to 9 months means we're touching March. So is this the sort of thing that could possibly prevent him from starting next season on time?
I think it may be a delay, and he may be one of those guys who's just a little behind the training schedule for next season. I mean, obviously, I hope not. We all want to see him kind of fulfill his potential, but it could be, yeah.
All right, let's talk about Cristian Encarnacion-Strand. This has kind of taken on a life of its own, unfortunately. So he's hit by a pitch back in April. They do x-rays, negative, but they find an old fracture. He misses a couple of days. And then they say, well, actually, there's a new fracture that they have discovered in the same wrist. So he's been out since then, since early May. He is progressing, I guess, nicely. And then they stop. He stops doing baseball stuff. He does an exam in a couple of days ago, June 5th, and they're trying to figure out what the next steps are. And he, the player, CES, opts for a second opinion. And then the specialist who looks at him determines that there's ligament damage on top of the ulnar styloid fracture. So there's a lot here. Let's go back and recap. What is an ulnar styloid fracture, which I guess was the original injury?
The old one, yeah. So if you feel your own wrist, if everybody pinches their own wrist on the pinky side of the wrist or your small finger, we call it the ulnar side of the wrist, there's a little bone that kind of pops out. You can roll under your finger. That's your ulnar styloid. So it's the far end of your ulna, the two bones in your forearm, the radius and the ulna. And it really serves no purpose, Mo, other than to be the attachment point for a little complex of ligaments and cushioning on the outside of your wrist. It's really commonly injured with like a forceful fall onto an outstretched wrist. So you trip and fall, you put your hand out, catch yourself. And there are a lot of people who have old injuries from those kind of, quote unquote sprains that they didn't know about. But mixing in the hit by pitch and the old injury, it's getting a little confusing with CES, isn't it?
No, big time. Yeah, that's why you're here. So, I mean, are we talking about something here where maybe the fracture was so severe that it perhaps made the ligament damage hard to detect?
Yeah, agreed. Yes. Hard to know. Again, it seems like something when you got hit by the pitch, it prompted, enough internal bleeding, inflammation that this is something we see in sports medicine sometimes where maybe an old injury that an athlete is quote unquote compensating for or living with, something new happens and pushes them over the edge where they're no longer able to compensate or live with that injury and it's now symptomatic. And, and it gets confusing to the athlete. Well, why did it not bother me before? Why does it bother me now? But it seems to be one of those situations. So I kind of agree with your statement, yeah. All
right, so now they're exploring the possibility of surgery. Because this just seems to have not gone well from the get-go, I guess the cynical part of me assumes he's just going to have surgery. Does this feel like that's the likely outcome here?
Yes. I mean, I always hate to project on these things about medical stuff, but it does. Given the way things have gone, it feels that way to me too. And again, this is a reasonably successful surgery. It's typically done arthroscopically or with the camera or sort of a minimum arthroscopic and open assisted approach. It's a pretty successful surgery, a pretty good track record. I will say I'm laughing. All of us in Cincinnati having our favorite athletes having wrist surgery is getting a little old to us. But generally it's associated with good outcomes and return to sport.
All right, return like early next season, on time in 2025.
Agree. He should be on time for spring training. Yeah.
All right, Dr. Trevor Wilkes from OrthoCincy. One more red to talk about, and then I have the injury that I'm probably not going to be able to pronounce coming up in a second. But I know how to say right lat strain. Emilio Pagan is dealing with that again. Let's begin with the lat. What is it? How does it work in relation to other muscles?
Yeah, so the latissimus dorsi, or your lats, a big muscle on the side of your back. So if you pull your elbow out away from your body and you feel that big muscle that kind of wings out, or in bodybuilders that kind of wings out, that's your lat. It's really important to shoulder function as it pulls your arm down. So you could imagine doing like a pull-up or a row, and your lat's going to be pulling your arm down. And so it's important in throwing, obviously, because it helps you to generate the rotation to throw the ball, and it helps you to control what you're doing with the ball.
Based on what we know about Emilio, they're talking about the likely outcome is he's available in the second half of the season. Now that's a large swath of time. So kind of walk me through the likely timeline here.
Yeah, and I guess just for the audience, the relevant thing is these muscle injuries are really tricky, Mo. By strain, what they mean is internal damage to the muscle. And this would be really similar to our Reds athletes with hamstrings or obliques or different muscle injuries. And athletes are so different in the way they respond to that injury. And we hate it as athletic trainers or doctors because predicting timelines is so challenging. And you just kind of take it as Emilio progresses in the training room, which is why I think they left such a wide scope of injury. And then the last point I'll make is just they're prone to re-injury. So if you're going to make a mistake, you want to you want to err on the side of caution so that he doesn't re-injure it.
All right, so usually when I get you or one of your colleagues on, I at least have heard of the body part that we're talking about here, or I've heard of the injury, even if I need your background and expertise to kind of explain what the next steps are. So the NBA Finals are happening right now. Kristaps Porziņģis plays for the Boston Celtics. He just missed about 5 weeks with a soleus strain, and so yesterday I see all the NBA writers on Twitter, they tweet about his latest injury, which may or may not keep him out of the lineup tonight. I'm going to read this verbatim, and pardon me if I screw it up. But he is dealing with an injury to his left leg. It's a torn medial retinaculum allowing dislocation of the posterior tibialis tendon. That's a lot of word salad there, Dr. Wilkes. What is that?
Yeah, you did a good job. You did a really good job. Yeah. So that is unusual injury, and I want to make a quick tie-in just for fun here at the end. But Kristaps has had a lot of injuries, but so this is at your ankle. So on the inside of your ankle, you're going to feel a bump. That bump is called the medial malleolus. So that's bone. Go behind it, and behind it there's a series of tendons. So tendons are what connect muscles to bone so that the muscles can do their action. And these little tendons, we need things to hold them in place so that the tendons don't go snapping back and forth and going in places they're not supposed to. So the retinaculum is the name of a structure that holds the tendons behind that bump. So the muscle's kind of up in your lower leg, kind of on the inside of your calf, and it helps move the ankle and foot bones. And so this retinaculum is torn, and now that it's torn, the tendon can actually slide in and out from behind that bump, causing tendon irritation. So that's the injury.
All right. Is it a severe injury? Like they say he could play tonight. I mean, to me, the more verbiage in an injury, the more severe I think it is. Could he play through this?
Yeah. So there's actually a fun back. So the short answer is yes, absolutely. Okay. If the tendon will stay behind the bump, the medial malleolus, and sometimes we can do tricks like we can tape it, wrap it. And, in basketball, you can even get away with some pretty bulky braces. And if the tendon will stay in place, then he's going to be able to play. A really awesome tie-in just for your audience. But if you remember the Curt Schilling story, when they sewed the tendon, so this is the other side of the ankle, Mo. So in Curt Schilling, on the outside of his ankle, he had the same injury, but the peroneal tendons were snapping out of place. And the team doc for Boston sewed the tendon to the skin so that it wouldn't come out of place. That was the whole bloody sock saga. That was such a great story. But if Boston gets another bloody sock story, it would be classic. It would really be great.
20 years later, that's right, in the NBA Finals. We'll see. We'll see what happens tonight. I appreciate the time as always. Awesome expertise. Lots to talk about. We'll do it again, man. Thanks so much.
Thanks for having me.
All right, there you go. That's our guy, Dr. Trevor Wilkes, OrthoCincy. I say it every week. The great thing about the people at OrthoCincy is they have specialists and locations across the tri-state, including walk-in orthopedic urgent care weekdays, 9A to 9P, Saturdays, 9A to 1P in Edgewood and Anderson. It's easier than going to an ER, and it's cheaper than going to an ER. When you have an urgent orthopedic injury, go to OrthoCincy.com, OrthoCincy.com. Hey, it's Mo Egger. There's no better place to hang out during the summertime than any one of the 3 Long Necks locations in Northern Kentucky. Wilder, Hebron, and Richwood, an awesome outdoor patio, a great menu, Northern Kentucky's best wings, and an amazing beer selection. But have you ever thought about how cool it would be to have a Long Necks in your neighborhood? Well, your chance is here. Check out the franchise opportunities at longnecksportsgrillfranchise.com, longnecksportsgrillfranchise.com. Long Neck Sports Grill. Stay long, come often.